Hey, this is Erin. It's week 3. Here is my skills blog. Planning and organizing are two important skills that I would use to secure needed resources as a manager. Planning resources for a clinic similar to the one where I work takes a lot of experience. You have to know what is all involved in the daily routine of the clinic. Usually, when I tell people I work in the outpatient pediatric dermatology setting, they think that seems like a cake job. Well, yeah, it's not neurosurgery or the ICU, but we are extremely busy. And to run it, it takes a lot of planning and organizing, especially with staffing. We see about 60 to 70 patients in a day's time, the day being 8 to 3:30 minus the 12 to 1 for lunch. So condensed day and a lot of patients in that day. So if we're not organized, the clinic is not going to run very smoothly. On the skills questionnaire, I scored high on the administrative skills, which would help in the planning and organizing situation. Also, equally, I scored high on the interpersonal skills, both with 25. And using published literature in the process of planning resources, I would use, related publications to help justify our resource needs. Resource research shows you need a certain knowledge level to serve in healthcare, but statistics are also relevant in providing that evidence to support the resource needs, especially with staffing. Statistics in my clinic would be, you know, no-show rates, the amount of new patients, the amount of more acute problems that we see, um, that kind of thing. So also the length of the visit. We like to see one patient per 15 minutes, but it's not always the case depending on what we need to do for each patient. So statistics like that would help justify, the need of more resources, especially with staff. The article I read this week is about utilizing multiple disciplines in the care of the patient. We have one multidisciplinary clinic that includes dermatology that meets about 2 to 3 times a month. Our dermatologist is a part of that and helped head that up. It's for the care of vascular malformations. Specifically, we see a lot of hemangiomas, port wine stains, lymphangiomas, vascular, just tons of vascular malformations. Yeah. And it's a multidisciplinary team approach. Like I said, we have a ear, nose, and throat specialist, we have a plastic surgeon, and then we also have our dermatologist. Um, the team approach for care is really ideal in these situations and a lot of situations for patients because you get the expertise of the multiple providers and they all have the common goal of treating the patient. Um, so it's very, very neat approach to me. So to be effective in my role, I would collaborate with multiple departments. As a manager in a department like mine, you act as a liaison not only for the nurses, but between nurses and providers and between upper management and providers. Also, we work with multiple other specialty clinics closely, not only in our multidisciplinary clinic, but just in general, we work closely with plastic surgery. We refer a lot of patients to them a lot. We work closely with cardiology. We work really closely with allergy because a lot of skin conditions kind of go hand in hand with allergy. So interacting with their managers, that's an important role of our manager. Looking at the vertical and horizontal structures, both have pros and cons in my opinion. In the vertical structure, the managers have fewer subordinates. Um, there's a hierarchy in place, but that's where your communication can be hindered because of the many levels of the organization. In our department in our hospital, communication is always an issue because there's so many levels of people that you have to kind of get through to, and the communication doesn't always trickle down to everyone who needs to know what's going on. So communication is always a big issue in a clinic like ours. You know, a small clinic in a big hospital is not always the best place to be. The horizontal structure is less rigid, employees have more freedoms, but the manager's not always readily available when a need arises. I think I prefer the horizontal structure because most nurses that I've worked with are self-motivated and don't need to be micromanaged, so the manager doesn't necessarily need to be right there all the time. Also, I found when you have kind of a hands-off manager or somebody who's not readily available all the time, you learn to problem solve on your own. You know, you work through issues with patients or issues with the providers or issues with supplies or, you know, whatever you need to do, you work through it because there's not always that crutch. I don't know. There's not a crutch of having the manager readily available. All right. I think that's it. Thanks.